A 26-year-old male patient presented with dimness of vision in his left eye since last 3 months with no systemic disorders. On examination, right eye visual acuity was 6/6 and left eye 6/60. Anterior segment examination revealed both the eyes within normal limits. Fundus examination revealed right eye within normal limits and left eye optic disc pit. Optic disc pit is a scenario where we find the optic nerve pit with central serous chorioretinopathy, which means that the patient has a congenital optic nerve pit which at some point in the lifetime of the patient collects fluid under the macula, which leads to the decrease in the vision of the patient. The OCT reveals skytic changes at the macula. The standard procedures for the management are pars plana vitrectomy with or without ILM peeling and gas injection. Here we plan for a novel technique of ILM flaps to seal the optic disc pit. Standard 3 ports are made 4 mm from the limbus as it is a phakic patient. We can see the congenital optic disc pit in the temporal margin of the disc and an altered reflex of the fovea, which is due to the presence of the fluid collection. We start with a core vitrectomy. Triamcinolone is injected. PVD is induced. Once PVD is induced, brilliant blue G dye is injected. ILM peeling is started by the pinch and peel technique. Our aim is to peel circumferentially. And to go over the macula very gently. Generally, I peel around 2 disc diameters of internal limiting membrane around the macula. Now here we plan for the ILM flaps to seal the pit. Now we prepare the ILM flap for sealing of the optic nerve head. Now we can see BBG stained ILM flap sealing the optic disc pit. We put a drop of viscoelastic over the flap to keep it stable over the pit. A very light laser is done in the temporal margins of the rim. Before we can apply laser, we will titrate it peripherally so that we do not do a dense laser. A very mild blanching of the grey burns are given at the temporal edge. 2 rows of burns are enough. the aim of which is to possibly create a very light barrage to prevent any passage of fluid from within the pit towards the macula. Fluid air exchange is done very gently so that the flap remains in situ over the optic disc pit. C3F8 gas is injected, cannulas are removed, ports closed. Post-operative 1 month, we can see some cystic changes still persisting in the macula, but the best corrected visual acuity improved to 6/18. Post of 3 months, the macula is absolutely flat and the optic disc pit is sealed. Best corrected visual acuity improved to 6/9. So we can conclude that ILM flap sealing of the optic disc pit is a novel technique for the management of optic disc pit maculopathy. Thank you.